That's why I sent you the picture on your WhatsApp. I said, treat me like a 22. So I sent you a picture when I was a 22-year-old.
Okay, sir, I just saw that. Now you're my junior.
Yes, absolutely. So I wanted you to feel relaxed. So, this is the great thing in our culture. It's respect the elders. And that's the beauty. And this is what we should continue. But don't feel scared of the age. So I say the if old is gold, the young are the platinum. So
I'm not scared from you. I'm scared from your experience.
oh no, you should benefit. Actually, you should feel strength that I can be at your help. Ask me anything.
Sure.
What
Thank
as
you,
I
sir.
was mentioning, as was mentioning the other day, you how I say the if old is gold, the young are the
So, how it is started, Zishan? How will we go forward?
Okay, so first I'll give the introduction of our session, and then I'll introduce you, and then you can start sharing your screen when I say that you can go ahead. Let
Okay.
me see.
Can I try once to share the screen right now?
Yes, please, you can do that.
It is,
Yeah,
you can
that's fine.
see my,
You can keep the first page. That's fine.
yeah.
Let me see if we have participants now on our channel. Mm, yeah.
I'm just closing my video for a second. I'm coming back.
No problem. Take your time.
And in the meantime, I may check my.
Yes, sir. You can also check.
What did I do wrong? Let's see. Omit the Zoom. Zishan, I kind of lost my screen. Let's see this one.
But I can see your screen, sir.
Can you see? Is it on the share mode? Or?
Yes, it's on the share. I can see
Oh,
your
the top is the control stop share. Okay, I got it. So okay, leave it like that.
Yes, sir. You can leave, or let Dr. Shazia share her screen first.
Okay.
I guess we can start. Okay, so we can go ahead and start. Assalamu alaikum, everyone. Before we begin, please mute your mics. Giving Back to Pharmacy in Pakistan is pleased to bring you a very informative session today on area of practice in pharmacy, which is most fresh graduates and practicing pharmacists are aspiring to become. That is a day in the life of pharmacists in informatics. Information technology and artificial intelligence is the future, and the more quickly we adopt it is much better for us. Thank you everyone for joining. We have two international renowned speakers in pharmacy informatics today with us. I will share the program today, and then we can go ahead with our presentations. So we'll have two speakers with us. Each presentation will be for 15 minutes. And then at the end of the two sessions, we'll have a 30-minute questions and answer. I would like to request our attendees, if they have any question, they can leave the questions on YouTube channel, and we will ask those questions at the end of our session with both of the speakers. So our first speaker today is Dr. Shazia Nasir. She is a pharmacist who has 10 years of experience in multiple aspects of healthcare and pharmaceutical sciences. She holds a master's degree in healthcare management She is skilled for healthcare strategy development, project management, communication, leadership skill, and she has solid understanding of healthcare operation and latest trends in the industry. She is currently working as clinical informatics specialist in American Hospital Dubai, where she supports implementation of solution through integrative approach that incorporates knowledge of current and future technology. We are very pleased to have you, Dr. Shazia, with us. Please, you can share your screen and start your presentation.
Welcome, everybody. Thank you so much, Dr. Zishan, for a great introduction. Just a second, I will stop sharing. So today I will discuss about the pharmacy informatics roles and responsibility and what is basically pharmacist informatics. So I will cover a few of the points in this cover my presentation. First, what is pharmacy informatics? Who is informatics pharmacist? Roles and responsibility, current technologies, and career in how I pursue my career in pharmacy, and other resources. So this is the one I have a bookish definitions, like which I get from different sources. A unique subset of medical informatics that focuses on the use of technology and drug information to optimize the use of medication effectively. And there is other, the integration of the data, information, knowledge, technology, and automation in the medication use process for the purpose of improving health outcome. Basically, we are talking about here the patient safety. For defining this definition, I simplify it in this way: the application of technology and information system to the medication use process to improve efficacy. Any person who is working in healthcare setup, either it is clinical or non-clinical, the first thing that how they improve the system for the patient. And medication process, like use of the medication, is one of that hot topic for this one. So what pharmacy informatics are doing, they are doing designing, implementation, customization, support the health information system in any hospital and the technologies. I will explain more in the next slides. So basically, who is pharmacy informatics? It is a, like, the key word in this slide is the dual specialty. Pharmacy informatics must have 40% clinical knowledge, real world practice, and 60% informatics or technology. With this amalgam, you become an informatics. Without technical knowledge or without clinical knowledge, you can't work as an informatics. So what informatics is doing, they're analyzing pharmacy practice as from their analytical perspective, and also they analyze HIS system, that is called hospital information system, and other technologies from clinical and operational, because some technology is feasible for the clinical purpose but not for the operational. So as in informatics, we always see the bigger picture, but same time we never forget the end user, because we are implementing something big, but maybe that is adding more steps for the end user, which make their workflow difficult. So basically, I can say these are the basic 4 competencies which must be available or required in being an informatics. Basic understanding of the database. It seems very big word for the people who are not aware about much of the technology, but you can say the information center, software, hardware, procedure, medication, medical record, patient demographic, anything you can name it in the hospital, they are saved in this one. And whatever we are saving, we have to think analytically, because if we save trash, we get trash. So we have to be very careful what we are saving in our database. Knowledge about the health information system, software, hardware. Sorry. Okay. Can I continue?
Yes, Dr. Shazia. Sorry about that.
And other technologies which is helping in automation. I can say, like, all the processes which is happening around the hospital, pharmacy workflow, physician workflow, and nursing workflow, you must be aware about all these things. And you have to have an idea that what you can automate and where you need a human interaction, because you can't automate everything. Somewhere you need to place the rules. And again, I come knowledge about the medication use processes, like transcribing, prescribing, dispensing, administration, and monitoring. Then I come to the third last point, strong understanding of pharmacy practice. Because pharmacists here all over the world is not only dispensing, we are doing a lot more than that, like ADR reporting, antibiotic stewardship program, we are doing interventions, we are doing, being in pharmacist, we are doing medication reconciliation compliance, we doing medication error reporting. There's a lot which is done by the pharmacist. And if it comes to technology, it's make the helpful by reporting, helping using the HIS system. The behaviors which our informatics carry with their, first of all, they have to be aware about the all the new technologies happening, updates happening around them, and what new updates in their current HIS system, hospital information system. And these, they have to aware about the their regulation and their policy and protocol, because maybe your hospital information system have the capability doing lot of things, but your regulation is not allowed to do it, so you both on the same road, so you must be updated about that one. Ability to anticipate future needs and challenge. Whenever, as a pharmacist, when somebody requesting me to build something or implement something, I have to think that in future, can I able to customize these things? I can able to change and modify it accordingly in the future needs, or what I am building currently, it will be helpful in the future also. So always I have to think before build anything new in the system. Ability to think about the end user, this is really very 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 important part, being an informatics, being an IT person. When you are implementing in anything new, any changes happening, any modifications happening, you must coordinate with your end user. For me, my end users, pharmacists and physicians are mostly, so I have to go and tell them, see, I'm going to do these changes and how it is impacting your workflow. First of all, whatever I implementing, it need to be improve their workflow, not a burden for them, and it is must be with their consent. Third, now I can see the ability to train and teach the end user. Whenever the new physician, new pharmacist join the organization, I'm training them on the current HIS system, and I'm teaching them new technologies whenever they are implementing and coming across. Now I can move forward the last thing, which is, I think so, communication skill is important in every field of the life. There is no field which you can say communication is not important, especially in healthcare, between the pharmacist and physician, between the pharmacists and nurses, and in the on the basis of technology. It's like that, what I have built in the system, how it flow from physician to the pharmacist and pharmacist to the nursing. So that is my communication skill through technology. Additional skills, or you can say soft skill, project management. When you receive some projects, you have to plan accordingly, what will be the timeline, how many people you required, how many tools you have. So you have this skills very much required in IT, I think so, because as work as an clinical pharmacist for many years, I need these skills there, but in IT it needs more. Definitely, if you are in IT, you need a technology orientation. If it is something new which is you don't know about it, you always have a crave to learn more. Analytical thinking, anything, I can say, it is a key for to be an informatics. You can forecast, you can do research, you can do data mining, you can have a problem solving skills. You must have means you can integrate, split the information in a small categories to draw a conclusion that what will be you're going to deliver to the end user. Innovative, innovative is anything which improve the productivity. So I think so the best example I can go with the innovative is robotic pharmacy. These are the few roles and responsibility. I'm not going in deep, but I think so this is basic roles and responsibility of being in informatics. First thing, ensure patient safety. Anything which any healthcare person related to the in any healthcare organization must be patient, think about the patient safety, and it must be patient centered. Always serve to your organization as a productive staff. Always guide or being a leader to the organization to inform them that what technology is required to use the medication in an effective way. Being a, I can say being a bridge between pharmacy, IT, physician, nursing, all the other hospital department. I am like recently we are moving from one system to other system, so it is very important to be a part of so choosing a new system, choosing a new vendor. So your critical thinking, your analysis after the end user is very important. Education for the new system, new technology to the end user, and the basic thing customization according to your workflow. What you are doing, because every organization have a different workflow. Now move forward. Hopefully I'm not going after the time. I'm within the limits. Yes, Dr. Zishan.
Yes, yes, Dr. Shazia, you can
So
continue.
now I'm moving to some of the technologies. I want to share some of the like what is happening around the world in pharmacy practice regarding technology. So on the my left side, there is a world-based system which is available in the world: Apex, Cerner, Intersystem, Meditech. I worked on Intersystem 4 year in back Oman, where I was working as a clinical pharmacist and an end user. Now, currently, I'm working as on a Meditech as pharmacy informatics, and I'm moving from Meditech to the Cerner. I'm in the process of implementation of Cerner. So, luckily, I have get the chance to work on World 3 best system. But all these systems have four components, which is very important when we are choosing the any of the vendor or focusing on the efficiency and competency of the system. It is electronic medication record, which is very important. There is a lot of patients which don't know their history, they don't know their medication name, they know only the colors. So it is very important for the physician to take a decision, for the pharmacy for the reconciliation. Then CPOE, customer computerized order entry, provider order entry. It is mostly for the labs, radiology, and nursing orders we are using. Electronic prescribing. I don't know about much the other countries, but in Dubai, it is very important for the insurance purpose, and they connect it everything with the health regulatory. And most of the hospital in Dubai are doing the electronic prescribing by using the Dubai Health Authority portal. And very most important is clinical decision support. What clinical decision support is: drug interaction, drug food interaction, allergies, high alert medication. All these alerts, uh, their alerts are given to the pharmacist, pop up to the physician and nurses when they are prescribing or they are ordering some medication and other items. They are giving, sorry, they are giving, if the patient have clearance issue, they are giving the alert if you're prescribing such medication. So all these clinical decision support is very important for choosing any health record, or you're using any health information system. As pharmacy, I can say as pharmacy is changed a lot from when we start be doing the pharmacy, simple pharmacy, until today. There's a lot of change in the pharmacy. Now pharmacy is not dispensing or taking care of the physician patient. There's also how we can improve the cost effecting, how we can save the patient, how we can be more efficient than before, like to reduce the process with the safety. So there is few technologies, like I can say automated dispensing cabinets. It is implemented in few of, not in my organization, but I work with the two well-known name, I think so most of the people heard about it, is Pixis and Omnicell. I worked with Omnicell, but I'm unfortunately I'm not able to implement that. But it is very helpful for the pharmacist, is improve the pharmacist efficiency in as a clinical person, less than the physical efforts what they are doing. Barcoding, it improves the expiry of the medications, that you will not dispense or utilize expiry medication. And also cost reducing also, because you know that if this medication is going first, so you can use the FIFO logic. It means first expire, first out. So then it will helpful, and this FIFO logic is useful in the inventory management system. When you are have a small shop, you need to know how my, where is my item, how much I buy, how much I sell. So this inventory management is required in every field where we are doing buying and selling. In pharmacy, as a biggest revenue department in any hospital, so its inventory management system is very important. Currently in my organization we are using Lawson, but we are moving, I'm in the process of movement from Lawson to the Oracle. I'm also a part of this supply chain. This is called supply chain. And there is one more well known is SAP. This is very effective for maintaining the inventory of the medications. I never worked with this radio frequency identification, but it is very quite, I think so, more effective, and it will be implemented soon in other organization. I saw some online demo of that one. And then smart pumps, which is available in inpatient pharmacies, inpatient setup for the physician, for the nurses to infuse the medication, and the robotic pharmacy, which is the best thing, which is any hospital having, like Saudi German, in Jalila, in Dubai, I'm talking about Dubai hospitals, it's very effective for them. So again, as my topic was how to be an informatics. So if I can say again, world, real world experience. I can say not bookish experience, because when I become a clinical pharmacist, I see there's a lot of things which we study, which we are not practicing. So real world practice required. Understanding of medication process, how it is prescribed, how it is dispensed, how it is monitored. Then you have an interest of technology to learn about more, that how it is working, how data is going from one place to other place. So you need to know these knowledge about it. There's a lot of way to find this knowledge. You can do a lot of short courses available in the available online, on site. Currently I am my master's in healthcare management. It is a big semester I spent on information technology. There's a few courses I did it for the to learn the HIS system. There's a formalized training in some of the hospitals which is offering. There is a extensive experience in healthcare information. Like I was a super user in on InterSystem in Oman. So I have 4 year experience as an end user and the super user. Super user, a person who is involved in building something, like not in IT, but next to the IT, I can say. So I was interested that time, so I start in this field. So which is helpful when I moved to Dubai and start as in clinical informatics, which has helped me a lot. Now the important resources which I go through, this is ASHP. I did one certification from there, and there's a lot more. If you can subscribe their newsletter, they are updating about a lot of things which is happening around the pharmacy side world. This is book is very informatics books. I have that one. You can get this online, pharmacy informatics premium primer. It is available on Amazon also. And there's a very small short courses. Recently, this MIT Salon doing the artificial intelligence in healthcare management. In healthcare, it is a very informative course which is going to be happen in January 24th. So all these courses will help you to be an informatics, and it is depend upon your how you are enthusiastic towards the technology. These are the references I used during preparing this presentation. Thank you so much for your time. Hopefully my presentation and my whatever I know, I share with my colleagues, my pharmacists, and I'm really thankful for Dr. Siddiqui to choose me for presenting this one. And I'm really obliged to share this screen with Dr. Masood. It's a big achievement for me to share with a screen with the knowledgeable person. Thank you so much. Thanks a lot, Zishan. Thanks, everybody. Any question you can ask me.
Thank you, Dr. Shazia, for such a wonderful presentation. I believe you can stay with us till the end so that we can ask questions in the end. Now we'll move to our second presenter, Dr. Masood Farooki. Dr. Masood Farooki has over 35 years of experience in various pharmacy operation management and health information technology positions in Saudi Arabia and USA. He is a certified professional in healthcare information and management system. He, in 2001, led implementation of first hospital-wide point-of-care medication dispensing system, including anesthesia stations in the Middle East. As lead subject matter expert and solution architect, he provided leadership for designing, testing, and implementing of a state-of-the-art, fully integrated SAP pharmacy medication system, including ambulatory CPOE, OP pharmacy workflow, inpatient MAR, IV workflow, medication reconciliation solutions, and technology interfaces. He holds a patent for pharmacy system design in the United States and has several publication and presentation to his credit. He retired in early 2020 and now is available for concentration in the area of automation and pharmacy software design and development. Over to you, Dr. Masood. You can share your screen and share your presentation with us.
All right. Assalamu alaikum, everyone. Just let me know when the screen is properly shared. And Okay, is that fine, or you want to make a full screen?
So you can maximize and
Okay.
start.
All right. Shazia, thank you very much for an excellent presentation, and you for the very nice introduction. You know, when you become retired, you have basically, you're always looking at the past, what I was doing, and you still have energy, so you want to give it back. So when Sadiqian approached me, so I said, yeah, sure, I want to do. So I want to go beyond that. If anybody in this field needs help, guidance through review, and I'm there available. So Shazia has covered very nicely, and with her background, she has almost touched on everything. I will just build up on few comments, and then I will share one application that I was involved in, a situation in the hospital that basically will sum up the values, the qualities, and the requirements of an informatics pharmacist would be reflected in there to convey what I wanted to convey, at how it can be best done. I will begin by sharing very briefly this slide. That's where the whole revolution started in 1999 with the patient safety catching global attention because of the Institute of Medicine report. Before that, it was unknown. And then 10 years into this, almost nothing happened. And what goes to her is human, and all those reports basically brought to the surface of the word. And then the National Health Service in the UK, then the Germans, and everybody came. And what was the bottom line of their findings? The delivery systems in healthcare all around, and especially you can reflect it to the richest countries like the US, they are saying this, that we have a very unsafe healthcare delivery system, disjointed systems. Existing technology is not deployed. I mean, I know I've no shame to expose my age. You know, I started working as my first job in Saudi Arabia, and I was lucky to be a part of the best hospital that could be outside the United States, which was the King Faisal Hospital. And the testimony to that is that, you know, if you look around UAE and Saudi Arabia, almost 80% of the hospitals have directors of pharmacy. They come from King Faisal Hospital. Now, we started, the reason I'm mentioning that is the first day I started in September 1975, and the vision of the King Faisal was, and it says in the wording published, that this is the most digitalized hospital, and this is the word digitalized they used in 1975. And guess what? There was a CPOE existing in 1972 when the first CPOE was tried in the US. So we started in 1975 in Saudi Arabia at King Faisal with a CPOE. So pharmacy had to get started with those technologies. And they found out that, which is the point number 3, that none of them were using this facility, because most of the errors come from the prescribing errors, the lookalikes, the soundalikes, and illegibility of the writing. And they also concluded that the most errors are preventable, and that new healthcare system is required that will provide that protection, that better outcomes, patient safety, and medication errors are minimized. And one of the points they mentioned is need to maximize the IT technology. And they noted in their report, if you go in deep into Tour and Human and the following reports, that the barcode came in 1956. And it's a shame that just now healthcare is starting to use it. So what we find after 20 years, we find certainly that the healthcare is digitalized. Medication processes are mostly electronic. Services are expected to be faster. This is a general understanding of our administrators, and which they get it from the software like the Shazia mentioned, the Cerner, the Epic, the Interlink, and Meditech. They paste a very beautiful picture to the management that, oh, everything is automated, the process, your staffing will be required less. And the first hit that comes or expected to lose people is the pharmacy. They think, oh, every doctor is entering the order. You're not entering orders like before. So that's the first pressure that comes in. And also to keep in mind, I've not done a recent research, but this is 4 years ago. The bullet number 4, the electronic medication orders in the United States still show a 10% error rate when they reach the pharmacy. And the reason for that is poorly designed electronic systems, which the doctors and different hundreds of doctors' offices, they use, phone health, smartphone health devices that they can order. So they don't have the bells and whistles of a strong system. So what ends up is a false protection, and the orders have to be looked at more rigorously than ever before. Products are not barcoded. And I'm a strong believer that we need to work together to push the industry and the governments to put the barcode. I tried my best in Saudi Arabia, and finally, the 8 years ago, they formalized the policy. It is required now to have not only a barcode on the package, but also on the smallest dispensable unit. And the industry has not adopted 100%, but we have to dream and we have to start, and one day we'll achieve it. The other thing I need to share as my experience as informatics oldie is there is a pressure in the industry, at least in the US, and you will hear in pockets here and there, that there's no need for the pharmacist review. Because if the order, let's say there are 100 orders put by the physician into the system, and if all the alerts are green, there's nothing why the pharmacist needs to review. So there is some school of thought and some pressure, and we need to be aware of that. Now, this is just my few years old. I had done this slide to highlight this is our digital world. And you see on the top line is the government agencies, like imagine the immunizations record and narcotics use record. And on the right side is the patient who via Google and now Amazon is into the pharmacy business in the US. So the patient has access to his or her record. So at the bottom of the page, you see all different organizations, and I tried to show at that time, this was a presentation in Dubai, that an EMR, a Pakistan in Aga Khan, a Dubai, a whatever country in Shifa, they all have their local electronic medical records. But part of that, they need, or the whole infrastructure that is evolving in the US and in, I've seen in Saudi Arabia and in Dubai and in UK already exists, and in Canada, and I don't know about Australia. You guys are closer to that. So is it in the perfect shape yet? No. The steps are being taken. What we need to know, and the point I was trying to make is that when it comes to pharmacy, there are two things that we need to know. One is the drug list, what the patient is taking on currently, whichever source the person took a prescription. So as you see, each location has a pharmacy dispensing a, the flipping the caps indicate a pharmacy. When it comes to the basic narcotics, and you heard about how many people have died or into the narcotic endemic in the US, all because there is no control. People go to one state, cross the border, get a prescription because there's no record. People fake prescriptions. Fake prescriptions are created. So now a national clearinghouse is there, which the round box at the top, the National Data Clearinghouse, is the concept which I think is in shape in Dubai also, is where at least not every drug, you start with narcotics. It doesn't make a difference wherever you got a prescription in UAE or in Pakistan, let's say within the Pakistan regional clearinghouse. So every time a doctor tries to prescribe a drug, it goes and checks what did he get last time and where did he get. So this is a greater picture, and I think we need to evolve our thinking around a national repository of medication list, immunizations, and narcotics. But in terms of priority, narcotics, number 2, immunization records. If we start at that, that is a great. Now, who can be informatics pharmacist? Shazia covered it very well. But I'm an old guy, so I can smell things, I can dream things. You see. So I knew that what she's going to tell. So I'm going to tell the same thing in a little different words. Who's a pharmacist who knows the health-related policies, local laws, and best practices? When I say best practices, what are the blood pressure guidelines for, the ADA for the dietary, diabetes? Those are the sources of best practices. They come into the picture when you come into informatics, and you got to know. When I say related the national policies of health, who can prescribe, who cannot prescribe, what can be prescribed, you have to be strong in that. Because when you come into that group and that role, you have to represent the whole spectrum of knowledge. So analytical ability is a very strong ability practiced into design and the workflows. The current word in healthcare informatics is rotating around workflows, because work needs to flow, because there's no paper. So if doctor creates a prescription, where does it need to go? It needs to go to the next step after the pharmacist does verify. You could have a pharmacist sitting in Pakistan and verifying orders for a pharmacy in Dubai. And that's happening in the US now. There are pharmacists, because of the COVID-19, they're doing the first level of clinical verification in their homes. And the order is filled in a local pharmacy somewhere else. Ability to evaluate available health information technology from clinical and operational perspective, and to perform return on investment. The ROI is something that we, as informatics pharmacists, need to be very strong on, how to present the idea with a return on investment concept. That if we spend so much, if we prevent so many errors, we are bound to save those. You have to paste a good picture. And this person should be able to see, smell, and dream the big picture and manage the micro details. This person must be a patient safety advocate and conversant with the quality metrics. You have to be master of the quality metrics and what are the things to measure, what is being measured by the hospital, how to intervene and interact to put those in use. Now, what education is needed to start? Certainly, Shazia already covered about the sources, and I just wanted to share you a picture of a future informatics pharmacist or a pharmacist, totally digitalized. He's have so many gadgets around, and at least now it is just one phone. Do we need a computer or informatics degree? I say very strongly no. I'm saying that no, to encourage the young people to make the start. If I say yes, it is going to be an obstacle, and they will delay their lives for 4 or 5 years, and this has really no benefit. This is only to climb the ladder up to a higher level, but at the informatics pharmacist level, you don't need a degree. You need a basic understanding of database design. Strong knowledge of Excel. It sounds simple. Everybody uses Excel, but I think that when I interview pharmacists who are looking for informatics, I want a person who has done an advanced course in Excel. Excel, no matter you have Epic, no matter you have Meditech, no matter you have whatever other name you may have, they all are basically dependent on Excel. Every report that comes up Excel, every upload is Excel. So you need, to know Excel very well. And I'll tell you one very simple example. If you don't know Excel, you download a date of birth, a medical record of somebody's digital numbers, it is converted into a date into your output. So you need to know Excel very well. You need to know Visio very well, which is a Microsoft Office suite, not added into as a free for everyone, but it is very much used every day for the informatics pharmacist and in the HIT field, because you need to draw the processes. You need to make the workflow defined. Barcodes, Shazia acted, I think it's a lot more. It is the foundation of pharmacy in the future. We need to know the WTO laws and that everything must be barcoded, and we need to use pressure to make in our country a barcode available every, so that imagine scan, bedside scanning, retail pharmacy scanning, patient identification, and all that. So barcode knowledge, what types of barcodes, how to create barcodes, how to read barcodes, 3D, 2D, all that knowledge is simple, but you need to be conversant. And I like to share a small story. When I first gave the interview to 1975, my father used to teach at the medical school in Riyadh. So I went there and I gave somebody said, oh, King Faisal is coming up. And this was a American hospital, Hospital Corporation of America. So I had an interview, and the director of pharmacy asked me, do you know what's unit dose system? And guess what? I said, yeah. So he didn't ask me a further question. He moved on. The reason it's important of me mentioning that is knowing the definition or the concept is good enough many times, and we don't need to excel in computers. That's why I say that we don't need a degree in computers. You just need to know the terminology, and that is good enough to converse with somebody else who is expert. And he was convinced that I knew Unido's word. You know where I learned that? There was one class tutorial in our university in pharmacy, third year hospital pharmacy, and there was a mention about a Unido system by a professor who came from the US. Shazia already mentioned about the ASP certification. That is a must-do. That doesn't require much, and the second one that I'd like to mention, which is respected across HIT, across the world, is the CPHIMS, which is a certified professional in healthcare information and management systems. Once you do that, you are considered at par a certified person who understands the language of health information technology. You have to be an advocate of the quality and safety advocate, project management skills. If you can do a Lean Sigma or a project management course, those are the assets, and those recruiters always look at that, and they are your hands-on skills that you need. So what we need a super pharmacist who can see bigger picture and own the medication use process beyond pharmacy doors. Don't take that concept, I control my drugs within the pharmacy. No, we need to go beyond. It's the digital world. You need to support the nurses. You need to support the physicians, all other ancillary departments. So your domain is not the pharmacy. You are the full continuum of care where medication use goes. Pharmacists who act as transitional bridge between IT staff, clinicians, and IT experts. They are involved in the design, customization of the system, the technology, and they have to be expertise in clinical decision support, alert fatigue, and nursing domain. If you want to succeed as pharmacists in the new world, you have to make up very good understanding of the nursing domain. Now, the typical scenarios that occur, and they could be very much in Dubai and to some extent in the US, is what is on the table currently in the market. Implementation of the best of breed systems, which the 3-4 systems Shazia mentioned, they are a complete solution. They are called the best of breed systems. They come in, they basically take over your hospital. They basically take over Shazia's domain. They don't, you can just say things what you want, but they've already decided things with the higher management. All right, so So they enroll their system and they walk away, and then you will be left with the best parts of it and the least parts of it and the missing parts of it. Most likely, one of the famous one of those um, just the reports are all horrible. They just leave you with the good talk, and then we have to take care of that and pay more. Other scenario is, which also Shazia touched upon, switching over from one to the other. So one of the most difficult, I listed them in terms of difficulty to an informatics pharmacist. Then comes to maintain a system in place. Obviously, the best person will be who's already working as a pharmacist. He's a daily user, he's a super user, so that he can plug into a informatics role really very easily. Technology selection, we should be part of this. It comes into the domain of the pharmacist, informatics pharmacist, to help what technology to take. Again, many times it is the financial part that the management makes the decision, or the supply chain makes the decision, and you'll be left with the implementation and the rest of the stuff. The sixth bullet is the clinical system development. I think that's the case where I would imagine the development has come to an end in the West. Development has come to the end in the Middle East. Now they're all to number one, implementation of the BOB systems. But I think because of the price and all that, Pakistan could be a place where a lot of development or maybe happening. I don't know. But that's where the pharmacist has to be an expert to devise how the system should behave, what features it should have, and what safety measures you should have, and then the optimization of the local systems. Now, in the best of breed, the big challenges are, I won't spend time on that, are the workflows, the clinical decision support. The irony is that some of these systems, they come up with their own decision support system. You like it or don't like it. The order sets is a challenge, and the picture on the right side, the green one, is a nice picture I saw. It is like passing all the possible order and making them into, and going through the funnel and a filter, and you put all those aspects into one order set. And that is basically is the order set or plan of care, we call it. The other two parts that I marked it in red are the most difficult parts in a pharmacist, informatics pharmacist life, are the IV, because most of us may not be experts in IV, but that is the biggest channel when it comes to the creating the orders and creating, because the doctors are going to use that. Can you imagine a dopamine order being placed by the doctor, coming to the pharmacy? It's because standardized concentration now, you don't need to do any calculation. Put 200 milligram in 250 cc's and that's done. And then can you imagine the integration with the pump? If the label is barcoded, the nurse just scans the bag. The rate is already set up on the pump, and she starts the pump. That's the scenario. That's the safety the system holds, and that's one of the difficult areas to go into. The ambulatory systems, that all the big names that you heard today, they all have very poor ambulatory systems, but nothing you can do, nothing I can do. Live with it and make an effort to customize to the best. The reason for that is because this is not the core business in the US. So a hospital system, a clinical system does not dispense ambulatory prescriptions. And then are the reports, analytics, and dashboards. So in Pakistani scenario, how many minutes are there?
Yes, sir. We can. You can wrap as soon as you can.
Okay. All right. So so I can just skip. I just want to pass through a very quick few slides. Just give you an application of a KPI-driven improvement plan. We identified that we have patient unsatisfaction, long queues, and all that, long waiting times, medication errors. We are dispensing wrong medications, wrong quantities. So what did we decide to do the plan? If you look at the bottom, we did the physical changes. automation, which is to bring in loose tablet robotics and box dispenser. Next part was the analysis. So we said, we took in orders and we said, we took 1 day's orders, which was 3,493 orders in a day done in a pharmacy, one pharmacy. We found that 361 drugs are involved only. 201 were 61%, 62% were the tablets and capsules. So this was the basis of deciding that what to do, how many are ready to pack. So I'm just trying to highlight the thought process. So 370 medications, 62% tablets and capsules, 60% ready to dispense. So we will move on. And then the next question comes to the planning of the informatics pharmacist. Okay, how do I dispense and these 3,400 medications? How many windows I need? How many pharmacists I need? So I did a simple Excel-based formula that calculated the number of windows, how much time it takes for this to receive, verify, filling, checking, counsel, dispense. So how many patients we can do at a window, and then came to so this is the actual picture of the first design the architect did based on what we said we need the pharmacy. These are the windows. This is the inside of the pharmacy. This is the outside of the pharmacy. Now, when we first looked at it, all right, if you see the previous picture, the dispensing was to be done by these carousels, manual dispensing. So we looked at it, no way. So at that time we intervened, and you see these 3 boxes, which is the white boxes, and these are the overhead beds. So we said, no, we want to go to this level. So the pharmacist is in a environment of an office setup where the pharmacist sits and the drugs come to them. So in the end, we pasted this picture to the management that we want patient to come in, take a number from the queuing system, sit down, pharmacist calls the next patient, comes and sits down on the chair, verifies the order, auto system determines is it a loose tablet or is it a box dispenser or what, and then use of the barcodes in the end. So this is the final result. So we put 2 robots. This is for box dispensers on the left side, and on the right side is the loose tablets counting. Up 2 more slides and then I'm done. Now, another analysis, just to give you the example, is that you have to go through such kind of analysis and presentation to the stakeholders of designing of the prescription system. Looks like a simple thing. When a doctor creates a prescription, what should happen to the refills? Now, in our countries, we don't have refill, but this is the basis in the US, and we adopted that in Saudi Arabia in our system in Saudi Aramco. What happens electronically after 7 days, after 14 days, if the patient doesn't come, the automated reminder gets sent on the phone. Patient can reorder from the. So we implemented these 2 robots, and so this is the result. In box dispensers, like think of Pepsi dispensers, we load from the back. They drop all 15 drugs, let's say 3, 4, 5, 6, 7 drugs you see. They drop down, they are lifted up, and they are delivered overhead. This is the scene from the inside of the pharmacy. This is the actual picture of the pharmacy we designed. And these are the robots on the right side, and the delivery goes to the windows on the left side. This is the picture from outside. So this is a process. You can see the robots in the back, the patient sitting, and that is the result I wanted to show of a informatics pharmacist analysis, result of analysis, selection, implementation, and all those things. I'll end by saying that if you can dream it, you can do it. And one of the attributes of an informatics pharmacist at Shazia, and I watched you, that is ability to see the bigger picture and to be able to see, actually dream, visualize, and dream is the same thing. If you cannot dream, you cannot change the future. Thank you very much for your attention. And if there's any questions, we can answer it together, me and Shazia.
Thank you very much, Dr. Masood and Dr. Shazia, for enlightening us with informative role of pharmacists in informatics. I have a few questions which I would like both of you to answer. Even though you have answered this question in your presentations, but still we got this question on our channel. Maybe some people joined late. So the question is there any professional qualification required to be a clinical informatics pharmacist? I know that you have, Dr. Masood and Dr. Shazia have elaborated it in deep, but if you both of you can pick just one certificate or one book to start with, so we can answer this question.
If you allow me, Shazia, I can go first. The I think uh, the smaller things that I mentioned, those are skills that you need to have. So you can, but I strongly recommend the ASHP and the HIMSS certification. Those two things. ASHP certification is little, I will put it at number two. Number one, I will put it as HIMSS certification because that puts you in a bigger picture. All those, the corporations that we're talking about, big names, they all look at HIMSS. Half of them are all HIMSS certified. Shazia, please.
Yeah, I totally agree with Dr. Masood that these two things are important certification. But if you are starting with it, as Dr. Masood mentioned, the Excel sheets, you have to polish your technical skills. Meanwhile, when you get the certification, because even you get the certification and you don't have a technical skills, so even you will not practice properly. So you have, like as Dr. mentioned, that Excel, Viso is very helpful if you start working for your workflow. It's not for the IT person, even for your pharmacy workflows, your daily day-to-do things. It is, as Dr. Masood mentioned, that it is not free, but if you can do practice on that one. First thing I can say, polish your skill and then move forward and have some experience in hospital information system, and then go for the certification of SHP and HIMSS.
So there is one more question. Who does the barcoding? Is this the manufacturer or is this the hospital specified purchaser or specified
Yeah.
supplier for barcoding?
Again, I will take advantage of my age and I want to jump in fast. One thing I mentioned about the qualifications I forgot to mention, both of us, is a simple language. HL7 is also a must. So it's a must not to start, but it's a must as you go along. It's a health language standard 7. That is the language. We don't need to master it, but we need to understand it. Review course we can do, not certainly certified because we're not going to program. So it is basically the connectivity between the software and the hardware language is HL7, and that's another one standard thing. And what was the question? Was about
barcoding. Is it by the manufacturer?
Okay. Yeah. Now, barcoding, this is a dilemma that we have to do in the pharmacies, barcoding. Okay. When it comes to the products, when they come into your pharmacy, now the law, this is the 6th year law now in countries. I don't know about UAE. I know Saudi Arabia. There can be no product imported or manufactured in Saudi Arabia that does not have a barcode. Okay. Now let me give you. So that means that everything must be barcode to the point where it is received into your supply chain. The issue comes at the dispensing level. In the outpatients, you dispense the package, fine. But inpatient, the dose injectables have to have a barcode on the ampule. What British companies do, American companies are putting a barcode on the ampule, on the vial. But the European is they put on the box of 10, they put one barcode. And that's useless. You go to the IV room. So it must be that we must learn to ask that the manufacturers should do a barcode at the end use size. But if there are not, we have capabilities with the pharmacy systems to create barcodes to drive the system because bedside has to be there.
As Dr. Masood already explained that very well, I just want to add that in UAE there is some drug which is imported from outside. They are not barcoded. Then the issue come up that who will normally that everybody prefer to use the manufacturer barcode. But when you get the product from outside UAE and from UK, from US, anywhere, it is sometimes not barcoded. There is not registered drugs. So then in this situation, the pharmacy has to generate the barcode item, but that is normally 2D, 3D or GS1, GS something like that. And there is a one challenge for the unit dose also, that you have to print the barcode for unit dose. So if you don't have a proper machinery which cut the unit dose in a packet and barcode, then you have to need that things generate a barcode separately for unit dose. Otherwise, if you have blister pack big machine, So then this issue is also resolved.
Okay, Dr. Shazia, one question for you. So as we know that when we work with information technology, there can come many glitches and problem and troubleshooting. You need to require to work a lot on troubleshooting. So how, and also a pharmacist in informatics works on so many projects. So how do you plan your day? Means, do you give time for troubleshooting separately and project separately, or you just start whatever comes along and then you solve those problems?
I will start it. If you have a project, I have a timeline, so I have to do side by side. But and if it is something which is stopping my end user to work, so which is this has become a priority. So then everything on a side, I can't stop the operations. I have to work around. I have to figure out if it is not solved immediately, then I have to provide some work around to them. So this is my first priority, that their operational is not stopped. So I will do the either do the troubleshoot, or either I will provide the workaround for them. Then I will go for my day-to-day duties, either my project, either my reporting, either my any work which is related to my daily basis routine. But the troubleshoot, any error, anything where pharmacist call me, a physician call me, I'm not able to prescribe something, I'm not able to dispense this medication, I'm not able to review the order, I'm not able to change the dose. Then I have to on the right moment I have to take a decision, I take a step. I have to work with my vendor. I have to ask my application team that anybody who will be around to help me in this one, I have to work on that first.
Okay. Thank you, Dr. Shazia. Dr. Masood, one question for you. As you mentioned that if we implement complete robotics, then we would need less pharmacy staff. So do you think that it's a problem for human resource? We need to cut down the pharmacists after implementation of robotics completely?
Yes, it is the first thing your hospital manager will bring to the director of the pharmacy, that, okay, oh, we have the system now, or let's say two types of systems. One is the clinical system when it comes in. Let's say Shazia is going through changeover to Cerner. So the Cerner perception when they present is that there's automated workflows, there's no hard copy prescriptions, pharmacist doesn't have to read. So yes, how many orders? This is a discussion I've just done through Epic implementation in the last 4 years, is the same thing. And then basically, yes, definitely there is efficiency, but you have to justify that we needed into the new roles, clinical roles that we were not doing. So you get into those areas. So you retool, re-engineer your stuff. You never try to lose, because by itself, these softwares need 5 or 6 people to maintain the system, I tell you. So the informatics team grows because you have to every day change order sets, new order sets, chemo protocols you have to create. So yes, there's a pressure, but one we need to learn is to retool them, to justify them into the new roles to support clinician jobs that physicians do. I'll give you an example, very brief. You know, the last hospital, the example of the pharmacy I showed, 3,400 prescriptions per day. A lot of prescriptions expire, and it needs renewal. So what did pharmacy do? We created a role that the pharmacist clinic will renew the medications for primary care. So the two doctors were relieved for one pharmacist working and renewing the orders. So under the like I said, participative collaborative agreement with the primary care department. So I became the extended doctor, and I review the care. So we can order labs, we can review, and then we can say you need to see the doctor after this renewal, after 6 months or 3 months. So your retooling is the point I'm trying to make.
Okay, so last question. I would rephrase this question. Do you need a full-time employee in informatics, or you think that operational pharmacists can work in informatics and clinical side by side?
No. As I said, I think I answered in a way that when you have a full-blown system, like I've gone through 10 years I spent developing a system and maintaining our own system. Then it lived its life with the new digital world. Pressure came on. We had to change over to Epic. Now, Epic implementation alone needs 7 pharmacists. This is the requirement. They tell the management that tell pharmacy to give us 5 to 6 pharmacists. Now, once it is done, you can live with 1 to 2. 1 to 2. When I say 1 to 2, One is the lead, like Shazia. Let's say if she's not doing the whole hospital's clinical system, just the medication part, then the automated system like the PICSs needs one person, a couple of technicians, actually, those ones under you. So they take care of the problems. So one is, the answer is, one is the minimum, and plus more depending on the different projects that I listed, what situation it is.
I totally agree with Dr. Masood that currently I'm in the phase of implementation of new system from one to other. Migration is quite big. Although I'm taking care only pharmacy module and supply chain, but still it's huge because pharmacy is always, as my consultant is nurse consultant is saying, the pharmacy is the complicated module in all other modules like physician and nursing. So I need 5 pharmacists from the end user who will be the super user. And now for my help, I need 2 more person who's helping me in the supply chain, and one my counterpart will be soon join me. So it's not possible that I work as a pharmacist and my part time in my free time I come and work as an informatics. Informatics is a full-time job, and I think so it is we are work. I don't know others, but I am working even after hours, as Dr. Zishan mentioned, ask about the troubleshoot any error, so they can ask me in the middle of the night that the system is gone. What I will do? If there is nobody is there, the support team call me that is the clinical things, and you can change something or you can advise something. So it is not one person job. We need a team, and it is a huge work to, especially when you are moving from one HI system to another HI system. Even the day-to-day activities is quite big, especially the reporting part. When you are doing the reporting, because this is depend your reporting depend their management decisions depend upon a lot about your reporting things. How many medication usage, which medication you are using more, purchase things, clinical efficiencies, how the physicians are using system CPUE, how they are effectively using. All these things is depend upon your reporting things. So definitely the answer is no. Not one person can do that one.
Yeah, thank you very much, Dr. Shazia, and thank you
Thank you
much.
very much. It was a pleasure. I enjoyed it. The time
So
is short.
in the end, I just have one comment. I would quickly like you to respond to it. That's what I think. That lots of people, lots of pharmacists think that when we'll have complete implementation of robotics and information technology and artificial intelligence, lots of operational pharmacists will not be needed. So if we see now in organizations, we have a very the ratio is higher on the operational side and very low on the informatics side. So do you think in future, when we'll have a complete implementation of robotics, this ratio will shift? We'll have more in informatics and less in operational?
First, I want to, I know Shazia also used the term artificial intelligence, and it looks like the buzzword. It means nothing. Okay, so for us, we cannot even take care of the alert fatigue. So artificial intelligence, if it comes, it's like the homeopathic practice where you put the symptoms and you get what is your diagnosis. This is what the homeopathic doctors do in Pakistan. So we are far away from that point. And that if that level comes, that will be only for the clinician to help him, guide him through some diagnosis. Even the same thing, pharmacogenomics. There is only 2 lab tests available as of this today commercially, which are available in the labs. So those we need to know what are those 2 tests. If they come and is the clinical decision support, read those. So I think the answer to that is informatics is it shouldn't be seen as just the name informatics. Informatics is a role that is there in the beginning to implement the system, to make all the pieces of the puzzle put together. And this is a person who is a manager level person typically, or will become one at the level. And then there's several people will be working under the quality name shadow. We have to retool ourselves, educate, and take these new roles where we need to compete with nurses. So if you get into quality, if you're informatics, a lot of half the position nurses are taking. So not only within the pharmacy, there are opportunities. If we have those skills we are talking about, like who can be the EMR resource for them? The person, I don't mind if I'm a pharmacist, but I'm owned by the nursing department, that he's our point person, he's expert in EMR, he can help every nurse. Same way for the doctor. So I think there will be retool. Pharmacist is one profession, I'm telling you, that is getting a lot of attention because of the shortage and of the COVID. So primary care is going to become a domain of the pharmacy, and especially in Pakistan, we have opportunity. There's nothing stopping us to convert our retail pharmacies into primary care health centers. You you can do vaccinations. You can take, you can give a new shape. And I wish you can help me with the Pakistani group that has, I think, a chain group with the retail pharmacies. And I think we can share some session. Me and Shazia can share some ideas how to start building that concept of a cloud pharmacy software that all pharmacies in the group can use, and they have certain values. And also the other thing for Pakistan is what clinical decision support we're going to use. Are we going to develop our own? And I think these young people, if anybody's hearing, they should look at those business opportunities in those areas. A cloud application for retail pharmacies, so that we can then go to the national health government to say that, okay, if all patients who need vaccination come to us, we will send this through cloud to your depository record that person A, national ID number, this got this, narcotic control. So I think maybe you can plan some session where we can do some thinking process, how to set going and get some volunteers from the Pakistani group who can do the basic work, and we can do the nice talking.
That is a very good point of narcotic medication, Dr. Masood, that UE implement with the name of InHealth Open Jet, that one person can get the medication from whole, like Abu Dhabi, Fujairah, anywhere, and they get the notification. And really, it's really helpful for the
this
not
is
only
the
the
one.
patient drug abuser, it is for the pharmacist, physician.
Exactly.
It's really effective, and if we can apply this one in our back home pharmacies and that identification number, it will be a big help for our community.
Also, Shazia, if you need help, send me an email on the narcotic prescribing, because I know the Cerner, I know they have so many gaps, and they just will polish away. But I have our patent is in that, and you see the back, that flag hanging, the red one. That is the U.S. patent that we developed in the city, and narcotics was the one big development for Aramco. So that so we can talk about it more if you need help.
I just
because if I don't share, it will go with me. So I want to. That's why I'm saying that I love to talk and I love to share. I love to pass on.
Definitely, I do that OpenJet implementation in my hospital. That application from Ministry of Interior, and for that I learn a lot. So now that implementation integration part I'm doing from Meditech to Cerner, it has given me a big learning, and definitely I need a help for you. Such experience you have in multiple systems.
Call me. Arrange me a consultant visit. I'll come.
Sure, doctor. Sure.
Or send the project or the papers. I can do the review and whatever. I enjoy it.
So that's a very healthy discussion. We went a little over time. That's fine. But I have one last interesting question, which is very relevant to Pakistan. That's why I'm including it. So one of our participants asked that automation and robotics is something which is very quite costly. So what could be done in the low resource setting countries like Pakistan? What are the low hanging fruits for us?
Again, I'll jump into the retail sector and the hospital sector separately. Okay, in hospitals, the challenges is the point of care, the medications, there's no control, they're not available, people have to run down here, loss, privilege. So the point of care dispensing systems like Omnicell, like Pyxis, and by the way, Pyxis, people used to call me the guru of Pyxis because I brought it from the US the first time in 2001 and implemented the first one, as you mentioned in the intro. So I know people in there. If somebody volunteers, I offered it to Aga Khan, and it didn't happen. There is enough old machines available in Saudi Arabia. I mean, I threw 100 machines just before coming. They are still working. So we can have a donation to start that concept. So for hospitals, Pyxis is a must. If anybody hospital has, they can start in a small way. There's a Turkish manufacturer now, equally good. he can get in contact with them with good relations, government to government. I know the Turkish connection. That is for the hospital. That's one technology that is needed to control the hospital. When it comes to the retail pharmacies, let's say Shifa Hospital, their retail pharmacy in the hospital. So there they need what this experience that I showed you, the two loose tablets are not in Pakistan much. You don't count tablets. Everything is a pack. Now the only challenge in Pakistan is वो पत्ते से दो काट के देने हैं कि you're gonna give the full patta or you're gonna give the box of 30, right? So for that, in my opinion, the most affordable and the cheapest technology at the outpatient retail pharmacies is the Consys. I have shown and I implemented it how it works. Now all Saudi Aramco pharmacies have that. Loose tablets brought up. There's a robot that counts, labels, steps. If the order is, it drops. The pictures that I shared showed. So this is not very expensive. Think of it, you put money in Dubai also, you put money and you get the Pepsi from the drop down, right? So it is like that. You feed the boxes from the other backside, and when you place the order, it dispenses. You can cut the cost if the distance between the pharmacist and this robot space is not enough. There's no need to spend money on the robotics overhead belts. There are 4 points on each side: window 1, window 2, window 3, window 4, 5, 6, 7, and 8. So you dispense, the product comes there directly. So there's lookalikes is taken care of. It has online inventory. So at the time of when you put it in, you put the money in. I think the time is over probably.
Yes, sir, I think so. But you explained very well.
I think the time dropped off. You're still there. So
yeah, it is done because 6:50.
So I think for outpatient, I don't know, Shazia, how big is your outpatient operation in the hospital?
We are dispensing in a day 500 patients, prescription per day.
Okay, so I think if you want, I can send you more information. And how much is the loose tablet ratio?
In outpatient, we are not dealing with the loose packet because the Dubai is not allowed in outpatient to dispense.
So the Consys is the best and the shortest footprint, just by 4 meters by 2 meters is the space needed, and you can put up to 1,000 items in there, and so you control inventory, you control, and you link it with your software server.
Okay, thank you, Dr. Masood.
Thank you so
much. Thank you, Shazia, for giving us time from your busy schedule and enlightening us with such an informative presentation and healthy discussion at the end. And for everyone, I would like to introduce medication safety is going on for a long time. We have a medication safety, what do you call it, program going on. So we are conducting it. So there are 3-step: contact a community member, ask them to fill a medication list and share those lists with us on these forms available on all our social media platforms. You can find them there. Thank you very much, Dr. Shazia. Thank you, Dr. Masood, for your time.
Thanks a lot for organizing.
And any follow-up session that is needed as more depth into a particular segment, let's say the automatic dispenses devices, what to look for.